Chapter. So we are starting right now. So welcome everybody. Welcome to our COVID-19 vaccination webinar. And so I'm Caitlin Franco, the Executive Director and Founder of Equality, and we're really excited to have you here with us tonight. I'm going to do some quick introductions. Right now on the webinar, we have Daniela Ramsey, who's our parent coordinator for 6th through 12th grade. Amanda Huza, who is our middle school principal, who's going to be moderating this evening's event. And then for Montefiore School Health, we have Dr. Delaney Gracie. So I'm going to do a little more of an introduction in a second on Dr. Gracie. So first, since we have some parents here, we do want to do a plug for our parent involvement. So Ms. Ramsey, as our parent coordinator, I'm going to let you take over for a minute to let parents know what you have going on at Equality.
Good evening, everyone. My name is Ms. Ramsey. I'm the parent coordinator. Welcome, welcome. I just want to talk a little bit about the PTA. Our goals are to maintain a strong and support PTA and to promote parent involvement in the school, at home, in the community. We welcome parents, grandparents, and any guardians. If you would like to join or volunteer, your help is greatly appreciated. You can support with planning fundraisers, any family activities throughout the school year. Our PTA appreciates your membership and we welcome your ideas. If you'd like to join, please contact me, Ms. Ramsey, at equalitychartgroup.org. Welcome again. And next up is Ms. Franco.
Thank you, Ms. Ramsey. So I'm going to do an introduction tonight to, we have first questions. So if you have any questions throughout tonight's webinar, there's a Q&A feature at the bottom. And so if you click that Q&A, you can add questions as the night goes on. We do have a lot of questions and information to get through. Ms. Hughes is going to moderate, and at the end, she will make sure that all of your questions are answered. So you can pop them in the Q&A feature at the bottom as we go. And without further ado, I want to introduce Dr. Gracie. We are so lucky to have her. This is her second time she's hosted a webinar with us. She is a practicing pediatrician who serves as Director of Clinical Services for Montefiore School Health Program. As you can see from this really impressive slide, she has accomplished a lot in her career, and we're lucky to have her here. She is works a lot with children, youth, families, and so she's really happy to present to our families tonight. Dr. Gracie has a master's from Columbia. And as you can see from the last bullet, she speaks at academic conferences, congressional briefings. She was on the Today Show. She's been on several online baby care series. And so we're happy. I think, Dr. Gracie, you'll have to add webinars for Equality Charter School to that last bullet to add there. But we are really grateful to have you because not only are you extremely educated in this area, and this is in your wheelhouse, but you help to break down the information for all of us. So I know I was really hesitant about the vaccination last year. And after, I think, our first talk with you, there were so many things that you helped me understand. And so I'm really lucky and excited that you're here to speak to our families. And so without further ado, I'm going to turn it over to Ms. Huza, who is going to host tonight's event. And so I'll turn it over to you, Ms. Huza.
Thanks, Ms. Franco. So yeah, we are really excited to have Dr. Gracie here with us tonight. And so just let's go over what we're going to address tonight and what we hope we will be able to have some answers on. So the COVID-19 pandemic, where are we now? Specifically around the COVID-19 vaccine, what's available and how do they compare? We have some structured question and answers for questions that have already been submitted around vaccine creation, vaccine safety, risks, side effects, vaccine effectiveness, and reasons to get vaccinated, and then additional and continued precautions. And then we'll have some open Q&A opportunities given the time constraints. So let's get right into this work. Dr. Gracie, what is now available to specifically to adults, but also to children in terms of the new updates that have been provided to us around the vaccine?
Sure. Well, as you can see from the slide, there's still the three preparations that have been around for a while now, the Pfizer, Moderna, and the Johnson & Johnson. The Pfizer and Moderna are 2-dose vaccines, about 3 weeks apart that you're supposed to get the first 2 doses. The Johnson & Johnson was a 1-dose vaccine. However, all of those now, certain groups are eligible for boosters, and boosters are recommended. So for Pfizer and Moderna, it's recommended that about 6 months or a little bit later that you get a booster for those. And for the Johnson & Johnson 1 dose, if it's been 2 months or more after that injection, it's recommended that you get a booster there. I think the biggest news this week is that now Pfizer has a preparation that is ready for kids who are 5 and older. So it's a new group now that's eligible to be vaccinated, the kids who are between 5 and 11.
Awesome, thank you. I noticed in the news, and I saw some coverage today, pop-up vaccination sites. I know that our school got information about the fact that we will also be hosting a pop-up vaccination, which will include students as young as 5 years old getting vaccinated. We're at a co-located campus, our middle school, and so there's an elementary school, and I know that parents are signing up. So it's really great that they're making those opportunities available actually at the school locations. So we'll talk a little bit more about that in a second. But in addition to a pop-up vaccination site that might be hosted at my child's school, where else can I get the vaccine?
Sure. Well, I think the pop-ups are great, and those have started, and hopefully that can be convenient for people so you can get out there and get your kids vaccinated if you haven't already. But your doctor's office may have it, so it's worth a call and to ask them, because depending on how big the system is that they work with, they may carry one or more of the preparations, and certainly the local hospital and health systems and their clinics would have it. We have it in our Montefiore urgent cares and our regular Montefiore health centers, as well as in our school health centers as well. But if you look on the nyc.gov website, if you just Google nyc.gov COVID vaccine, you'll land on their landing page. And you'll be able to scroll through, and everywhere that they're giving it as a city-sponsored site should be listed there too. So it should be pretty easy to find someplace that's close by you. But you can start with where you regularly go for care, and you can ask them if they have any of the preparations.
Thank you for that. I know that when I got vaccinated, it was actually at a vaccination hub, but for my children, I was able to take them to CVS. And so it's great that it's being made available in such a wide variety of locations that are safe to be able to provide this.
Yeah, and we can talk about it a little bit more later, but certainly if you got your first 2 doses of Pfizer, but then they're offering Moderna where you're looking for a booster, that's okay. So there've been new studies and new information out that it's okay if your booster is not the same brand that you got for your original vaccine series. So it's okay if it is, it's okay if it isn't.
All right, so Dr. Gracie, we've got some hard-hitting questions. We want to make sure that our parents and our community are informed. So let's talk about vaccine creation. It seems like the vaccine was created in such a short period of time. How was that possible? Have there been enough tests on the vaccine to confidently say it is safe? And what is the evidence of this?
So even though some of the vaccine types, specifically the mRNA type, that's the Pfizer and the Moderna, is fairly new in terms of having vaccines that are being widely used, that technology has been in development for over 10 years. So it's not that they started from start to finish in the 2 years, 18 months since COVID became big in all of our lives. So there really is a much longer runway than I think most people realize of all the development that went into that type of vaccine. And then the part that was really expedited locally, people were highly invested in it being tested and coming out. So a lot of people volunteered for the studies on it, where they gave it to people and followed and, saw what kind of reactions people may have had and figured out what the optimal doses were for different age groups and things like that. There was a lot of interest in being part of those studies. So they were able to do those studies fairly quickly. And the part that was really expedited is some of the paperwork parts in the approval that tend to take a really long time. And obviously, since it was part of a public health crisis, a lot of that was compressed. And I think the CDC and other groups have done some smart things, because now over 431 million doses have been given of the COVID vaccination. And so, they're following really closely with all of those doses now given across the world, what side effects are people having. So now there's a huge mass of information on side effects, at very, very high numbers. So I think at a population level, we have really good data on what kind of side effects are there, who's at high risk for which kinds of side effects, and how does the risk of side effects from a vaccine compare to the risk of getting COVID, the risk of having similar types of side effects or, health problems related to the disease itself. So there's a lot out there. The smallest study right now is for the 5 to 11-year-olds, since that's the newest group. So that hasn't been, until now really given at a population level, but over 3,000 kids were studied. And actually the side effects were, the things like fever, sore arm, the minor things were about the same as they were in other age groups. But so far in that group, there hadn't been any of the severe side effects. And it's likely that, once larger and larger groups receive it, we're going to see some here and there. But so far the testing looks really good. And the dose for the 5 to 11-year-olds is a third of the dose for the 11 plus groups.
Got it. So what I hear you saying in terms of vaccine creation is it's not as short of a timeline as we think it is. The science has been around. They just took that science and applied it to this specific virus, the COVID virus. Okay, so thank you for that. You talked a little bit about some of the immediate side effects, minimal, that we're seeing, especially in that 5 to 11 age group in that small sample size. But in terms of, the vaccine being relatively new, I know that there's a lot of concern around how do we know if there are no long-term effects? So could you speak a little bit about that for us?
Sure, and that's a great question. And, I was actually listening to a talk about that just this morning, and they were talking about over the last 100 years or so, and, different vaccines have been developed as far back as the smallpox vaccine, most of the side effects that they've seen with any kind of vaccine have been within usually 5 or 6 weeks of when people got the dose. That's kind of been the tail end for when somebody started seeing problems. So just based on that and all of the other vaccines that people have gotten, it's likely that what you would see would be within that same time frame as well. Of course, they are new. So obviously people are watching this data as closely as possible and studying it and looking at theoretical risks just based on the science that was used to make the vaccines and, the science behind that. So they're pretty confident that it's unlikely that there would be side effects that you didn't see, much sooner to when you got the vaccine itself. Not impossible, but not likely based on everything that we're seeing so far and with the volume that have been given so far and the science behind it.
Thanks. So there are people still afraid of getting the COVID-19 vaccine for a variety of reasons. I know we each know someone in our own families, our own friends that are worried. We know people in our school community that are worried about this. What, as a physician, what is the most compelling evidence or strongest reason you could give someone to persuade them to get the vaccine? In other words, why should we get over our fears?
Right. And, and I think it's important to understand that everybody starts in a different place with this and everybody has their different understanding of it, their different concerns, their different experiences within their own family and with friends and family. So I think it's important that everybody's supportive of their neighbors and friends and family, with understanding where they're starting. That said, I absolutely recommend it for anybody that's eligible. My daughter is 13 and I got her vaccinated in the first week that she was eligible. I felt very strongly that it was the right thing to do because basically, especially with the 400 million that have been given out, you are so much more likely to get sick with COVID than to have a serious side effect from the vaccination. The people who are still being hospitalized for COVID are the people who are not vaccinated, the people who are still dying from COVID. And this is still absolutely happening every day. Those are unvaccinated people. So even though there is, you'll hear about breakthrough of people who have been vaccinated still getting COVID, and that does happen a little bit, and that's not unexpected. But those people aren't the ones getting hospitalized, and they're not the ones getting severely ill. So the vaccine is absolutely the most important way you can protect yourself from life-threatening illness. So I would say there's every reason to do it. And a lot of people, you may hear about different side effects or, blood clots or, other things that obviously are important and scary and, important to read about and understand. But the risks of having one of those is actually way higher if you get COVID than the possibility as a side effect of the vaccine. Much, much more likely to get it as part of being sick from COVID than the vaccine. Same with some of the hard things that you may have heard about in kids, myocarditis, which you hear about it in the news because it's important, but it's actually really, really rare. And studies have shown that the kids with COVID who are sick because they got the disease are way more likely to have that than kids getting that as a side effect of taking the vaccine. So even from those, you're way better odds on keeping safe from any of those things, COVID or any of those things related to side effects, by getting the vaccine as opposed to risking getting the infection itself.
You mentioned myocarditis. What is that exactly?
So that's inflammation of the heart or the covering of the heart. And, you know, they have seen that in some young people after the vaccination. But again, with these hundreds of millions of vaccinations given out, I looked it up earlier and I think there were about 850 cases, you know, out of millions of people that got this. So it's really relatively, you know, 0.00005 something percent. It's really, really a low risk. And the kids who got it tended to be between boys, it was more common, and it tended to be between like 12 and early mid 20s who were the most likely to have that as a side effect. But the vast majority that did have it were managed effectively with, you know, observation and support and some, you know, minor interventions.
And you're saying that that same issue can actually be brought on by getting COVID.
Absolutely. And it's more likely that you would get it if you had COVID than even if you were a boy and you had the vaccine. And usually the people who did get it, it was within about 3 days of getting the vaccine.
Okay. So again, not necessarily something that we're seeing as a long-term side effect that's popping up sort of unannounced. It's happening relatively quickly after the vaccine. So it's able
and other things and other viruses can cause that. This is not the only thing in the world. This is not a new condition that we've only discovered post-COVID or post-COVID vaccination. It's something that we see, you know, from time to time in kids and can be associated with other viruses and other things as well. But again, you're more likely to get it from getting COVID than from getting the COVID vaccination.
Thank you. That was really, really helpful.
Sure.
We're going to move over to vaccines or continue to move into vaccine safety. So can a COVID-19 vaccine make someone sick with COVID-19? Are there blood fragments in the vaccine?
So no and no on those questions.
Okay.
So if you get a COVID vaccination, there's not blood fragments in there. Basically, it's a little bit of code that helps your body. You know, you see all those pictures with the, you know, big coronavirus circle with the spikes coming out of it. And that's why it's called corona, because it looks like it has a crown of those spikes.
Got it.
And it's basically your body learns how to recognize those spikes. And so you make antibodies ahead of time against that. And so then if you were exposed to, you know, somebody with that had coronavirus, your body's ready and it's ready to just attack that right away and take care of it before you get sick or significantly sick from it. So it's teaching your body to ramp up its own defenses specifically for that virus, but it's not giving the virus to you. It's not giving you a killed version of the virus. It's just not giving you that. It's teaching your body how to make it. And the vaccine can't make you get COVID. So you can get side effects. You absolutely can have fever. You can have body aches. You can have some soreness at the site for a couple of days. Those things are well-known side effects from the vaccine. But that's not a mild case of COVID when you have that. That's evidence that your body sees it, is responding to it, is ramping up. But it's not that you've gotten COVID or a mild case of COVID.
Yeah. Well, I know from my second shot, I was completely wiped out for about 24, 48 hours. But certainly nothing like what you see with the symptoms when someone actually has COVID. So really feeling really fortunate that I was able to have the opportunity to move forward with my vaccination. So
yeah, me too. I had side effects actually after both of mine because you know, working in healthcare, I had been exposed to it, you know, just through work earlier on. So by the time I got my first vaccine, it was really the second time my body had seen it.
okay.
So, you know, I had a pretty good fever with it, but, you know, it's kind of great because I was like, yeah, my body's got this. It sees it, it's learning, you know? And so definitely with that, 1,000,000%, I was ready to get it for my daughter right away. My parents have gotten it, my sister has gotten it. You know, I absolutely made sure my whole family is vaccinated as soon as they were eligible too.
Awesome. So now I know that there are some questions around people who have had adverse reactions to other vaccines. So should someone get a COVID-19 vaccine if he or she has had a reaction to another vaccine, such as the flu vaccine?
In general, yes. So whenever you go to get it, there's a series of questions they should ask you, and you can mention that, but that's not a contraindication to getting the vaccine. That's not a reason to not get the vaccine. If you had an actual like anaphylactic reaction, if you had an allergic reaction that was so severe you had trouble breathing kind of reaction, they would definitely want to know about something like that, but it
Okay.
still might not mean that you're not eligible for it. It would mean that they'd watch you a little more closely. Your observation, standard observation after getting the COVID vaccination is 15 minutes. Anybody that we feel is higher risk, we watch for at least 30 minutes. Anywhere that gives it, there's certain emergency medications they have to have on site to be able to give it. So very, very few things would make you not eligible.
Thank you. So I know another big topic that comes up is around the COVID-19 vaccine and pregnancy. So if someone is pregnant or is breastfeeding after giving birth, should she get a COVID-19 vaccine?
More and more research is saying yes. And again, it's a little bit like the conversation that we had earlier. You're way more likely to have a side effect or a health problem or a negative outcome if while pregnant or breastfeeding or trying to become pregnant, you get COVID, as opposed to you get a COVID vaccination. So, you know, anybody who's pregnant or thinking about getting pregnant, you should certainly talk to your doctor and, you know, go into the details of whatever specifically is going on with you and your personal health history and all of that. But in general, the recommendation for if you're trying to get pregnant, if you are pregnant, or if you're breastfeeding is that you still get it.
Okay. And so you mentioned that that also applies to someone who's planning to get pregnant, but of course, reaching out to their individual medical provider in order to discuss their case on a more individual basis.
Yes, and I've certainly seen questions of, does it impact fertility or anything like that? And so far, there's no evidence that it does.
If someone has an underlying condition, should he or she get a COVID-19 vaccine?
Again, in general, the recommendation is yes, and it might even be more important for people with underlying conditions to get it, but everybody's situation is a little bit different. So we would say talk to your doctor specifically or your specialist specifically and find out for your situation, you know, what do you need to do? And for some, you know, with immune system problems, it may even make you eligible for boosters sooner or a third dose as opposed to an actual booster. But it's on an individual basis, but in general, they're going to recommend that people get it.
Thanks. Yeah, I know my sister has multiple sclerosis and had very specific conversations with her neurologist. She had to wait a certain amount of time. She could only get, you know, the shot under certain conditions where she could be monitored, where they were, you know, timing it with her other medication. But it eventually was given, you know, the green light to move forward. And I know she's a school teacher as well. So she's happy about that.
Yeah, I have a family member who has a chronic condition that makes them immunosuppressed, and their doctor was like, let's get you first in line, you know? And so that was definitely for her. It was all the more reason that her specialist wanted her to get it and wanted her to get that third dose as soon as she was eligible to. But it varies by condition, but definitely have that conversation with your provider.
That makes sense. So we've heard a lot of people countering not getting vaccinated with, I've already had COVID. Why do I need to get vaccinated? So if someone had COVID-19 already, should she or he get vaccinated or get the vaccine?
Yes, you still should. You know, as you probably hear in the news, there's different strains and different susceptibilities. The vaccines tend to cover for more of the strains. And again, it's not 100%, but I was reading that when there was a study done where they compared people who got COVID to people who were fully vaccinated. And of those people who had breakthrough COVID, and the people who had COVID but not the vaccines were 5 times more likely to have breakthrough COVID than the people who were fully vaccinated. So you're still a way higher risk I mean, it's somewhat protective if you had it, so that's good. But absolutely, it's recommended that you still get a full vaccine series after that, even if you were quite sick. And some of it is because of the different types out there. Some of it is because even with natural COVID that you were just sick, the immunity from that wanes as well.
Got it. So it helps to build that immunity back up, your immune system back up by getting that COVID vaccine.
Exactly.
So we talked a little bit about the COVID-19 vaccine in children, just some highlights again, especially around the fact that Pfizer is now available for children 5 through 11, specifically for our school community. That means our 6th graders are now, the majority of them are now eligible to be vaccinated. So some highlights around those studies and what they've seen in terms of the vaccine for children.
Yeah, basically, so they did a lot of studies to see what kind of dose made sense for the kids. And so again, the youngest and the newest group eligible is 5. There are studies going on with both Pfizer and Moderna that I know of, probably the others as well, as young as infants. So, at some point we'll probably be hearing about those too. But for the 5 to 11, like I said, they figured out that the ideal dose was a third of what the dose for somebody 12 plus would be. And that was kind of that magic point where it still created enough immunity where people were protected, but it reduced the likelihood of side effects. So you always want to give as little of any kind of medication as possible, but you want to give enough so that it works. And so that's where they hit that magic number. Sometimes people ask, okay, so my kid is, 10 today, and I want to give the first dose, but they'll be 11 by the time it's due for their second dose. How do we manage that? So it's whatever age they are on the day that they're getting vaccinated. So you could have a kid where their first dose is that smaller dose because, they're 11, but then they turn 12 and then they're, eligible for the larger dose, and then they get the larger dose for that second one. So it's whatever that birthday is. It's not based on weight. It's based on the age. And that's just the safest way to make sure people are doing it consistently and, not doing so much calculation that errors happen and things go wrong. And so those were the safe doses determined to be effective in those different age groups.
Thank you for sharing that. I wasn't sure how the doses were different in the different age groups, so that it's helpful to know that there are in fact different doses based on those age groups. In order, as you said, you mentioned enough to be able to provide those antibodies and that resistance and minimize the side effects.
Yeah, and so far the side effects, like I said, in the studies they've done so far have been, the serious side effects, none noted in the 3,000 that the major study has been. I mean, they still, certainly have the arm pain and the fever and the other things that we talked about, but not the serious ones, and even including anaphylaxis. So hasn't been seen yet.
Okay, thank you. So I'm going to skip the question about side effects. You mentioned, maybe some fever, arm pain, fatigue, in terms of those short-term effects. No long-term effects right now have been noted. How, if taken the vaccines, will it affect someone with multiple sclerosis? So this was a specific question. I didn't answer this question but there's a lot of people in our community, right, that know someone, that have someone that they love that are impacted specifically by that illness.
Yeah, and again, I thought your personal story about your family member is exactly how it would be for anybody. We'd recommend you work specifically with your doctor because everybody's in a different point in their own fluctuating course, and they can advise you, and based on what other medications you are, if you're in remission, what's the best timing and such for you. But in general, they recommend that people take it.
So the Johnson & Johnson vaccine had been pulled, right, because of links to blood clots. You had mentioned that earlier on. Just to give us some frame of reference, how bad was that risk of the Johnson & Johnson vaccine connected to blood clots compared to other medicines?
Very low. And again, it was pulled, but really just for a few days, and then it was back on the market. So it's definitely been back for a while now. And again, I looked that one up this morning, and what I saw was that there had been about 148 cases total. And again, we're talking about 431 million doses given. So it's a tiny number compared to that. Obviously, quite serious for the people who had it. But in terms of risk of it happening, extremely, extremely low. So you're at higher risk to get a blood clot if you smoke, if you take birth control pills. A lot of other medications have potential risk of a side effect of a blood clot that's exponentially higher than from the vaccine.
Interesting. Okay, thank you.
COVID itself can cause blood clots as well at higher rates than the vaccine.
Absolutely, absolutely. So this is sort of a rundown, right? Where everyone I know is very concerned about, like, what are the risks? What are the side effects? We've listed some common side effects here for our school community. Anything that you want to touch on this slide here? Any side effects that you think parents should be more sort of alert to or aware of as they move forward with making the decision to have their child vaccinated?
I think this is the right list. In general, if you were to get a fever that was more than 101, 102, you should probably call your doctor and just make sure that they're aware. Because it is certainly possible that you have the bad luck that on the day you got the vaccination, 2 days before you were actually exposed to COVID, and that, you know, kind of in the same timeline, you actually got COVID and you're having symptoms of COVID and not side effects of your vaccine.
Oh, that's a good point.
Yeah, so if you have, you know, fever more than 102, more than, you know, 48 hours, talk to your doctor, because that could be something else. You know, and certainly the flu is out there in the community now. RSV is another respiratory virus that we're seeing. You know, you can't just have the rotten luck to have fever from something else. So, you know, more than 48 hours, more than 102, make sure it's not something else. The other thing that I think you probably hear varying advice on, but one of the things I was reading about this morning is that some people don't recommend that you just automatically take Tylenol or Motrin with getting the vaccination, that it could blunt the response that your body has a little bit to the vaccination. So you might wait and see if you even need it. But certainly don't hold it back. If you're having the side effects, go for it. Take it. You want to be as comfortable as possible, and same for your child. But not everybody has side effects. So you don't have to just automatically give a dose of Motrin with the shot, because not everybody's going to need it.
I'll tell you, I took my 90-year-old grandparents with us when my husband and I went and got vaccinated. We got them vaccinated. I was the one laid up in the bed, and my 90-year-old grandparents were doing just fine, saying, "What's wrong with you? Get out of bed. Let's go." So it absolutely impacts everyone on an individual basis. And some people just have no side effects at all.
Yeah, I was the worst of my family. My 80-year-old father had, you know, he was a little bit tired the next day, a little bit sore. My 13-year-old, she was fine. You know, she didn't have a side effect, not a bit. So different for everybody.
All right, so let's dig into vaccine effectiveness. So can someone contract COVID between the vaccine doses?
You actually can. So, you know, whereas we talked about on that first slide a little bit, how effective is it, 90%, 92, you know, a little bit different between the different vaccine types. But, you know, after the first dose, you may only be at 50% protected, 60% protected. So you certainly can get it. Less likely to, but you can. So again, if in that time frame that you're exposed to somebody, you should still talk to your doctor, and they're still going to probably recommend that you quarantine, you know, by old rules, because you're not considered fully protected until 2 weeks after your second dose.
Okay. Can you get a COVID-19 vaccine at the same time as another vaccine, such as the flu shot?
You can, and you know, that's what they're doing for the medical staff at Montefiore now. Come get your COVID booster and we'll give you your flu at the same time. And so you absolutely can do that. We were looking into it with the littler kids, you know, if somebody was behind on their varicella vaccination, and, you know, even though usually you get that before you're 5, but sometimes kids need to catch up on that, or DTaP, or, you know, any of the usual childhood things, and you can give it with those. They recommend, you know, not doing it in the same arm as one of those. And that's partly so if you have, you know, any kind of reaction, you know which one it was to, quite frankly. But yes, you can give it with any of the other vaccines. In the beginning, there were some recommendations that you space it out, but now it's been given so widely, and we know so much more about it, that those stipulations were removed.
as a parent of two, being able to get medical procedures and doctor's appointments done as quickly and efficiently as possible is really helpful. So this is good information that it can be given at the same time as other vaccines. Will the vaccine protect against the new strains of COVID-19 that we're seeing? Variants.
It's always hit or miss. Pfizer and Moderna were fairly good around, against Delta, and Delta wasn't the strain that we predominantly had when, we had our first spike, definitely the initial one in New York City, and even in the, following 6 months or so, Delta was after that, and it's still fairly effective against that. But like any virus, like the flu, it's going to mutate, a little bit the longer it's in communities. And, the vaccines won't be effective against every single strain, but that's why, the CDC and the other organizations are always studying, they're always looking. You can, look at some of the infectious diseases pages and see, what different kinds are becoming more prevalent in different countries. And so it's all being watched very, very closely. And all of the different vaccine types are tested, against whatever's most prominent in the community at the time. And then that understanding is going into development of future vaccinations. So, it's possible that in the future it could be more like the flu, that, there's a slightly different version of it that's most dominant, as the winter comes, and they'll recommend that you get a booster of that each year, because that's where you get a booster for the flu, because it mutates throughout the year. And then there's a couple of strains that are common in any flu season. And they're not always something we've never seen before, but sometimes they are. And so then they'll produce the vaccine for that year to be targeting whatever strain is most common, in that year. So it may become a pattern like that, but I think we don't really know yet.
Got it. So you mentioned boosters. I'm going to ask you a two-part question. One part is on this slide, and then the next part I'm going to transfer over to another slide. So how long does protection from a COVID-19 vaccine last, assuming the second dose, right? If we're talking about kids, right? Because it's Pfizer. And then will booster or annual vaccines be needed?
And, like we started to talk about, we're still learning. And, I think 6 months is what we're starting to learn, at least with the initial vaccine series that we gave. And that's why now the boosters are being recommended, because after, continuing to study people after the first series was complete, now is when people are starting to go low enough, and that it's felt that it's time for the booster for those people that got vaccinated in like February or whatever, that the 6 months is where we need to go. If it, still needs one a year later, or is it more like some of the childhood vaccinations where, hepatitis B, once you've had your third one, you're good to go? I think we don't really know that yet.
Got it. Okay. So I know, like, for myself, I had received my second vaccination in February. So I'm going to be making my appointment to get my booster done. And then, like you said, we'll wait and see what they recommend moving forward. So I guess the next part is, and this is a tricky part, it's hard to understand. A lot of people are like, okay, we get vaccinated. What does that really mean? If a person is vaccinated against COVID-19, will they be able to spread the virus to other people?
So technically you still can. And that's some of what was in the news last summer, because at first, at the beginning of the summer, and when people got vaccinated, the CDC said, hey, if you were vaccinated, you don't have to wear your mask anymore. And then, I don't know, it was like a few weeks later, we're like, no, if you're on an airplane, you probably should. And so I think that was even part of the learning curve with that. So whereas, if you got the vaccine, like we were talking about, then your body is ready. It knows what to look for, and it's ready to jump on that virus and defend you when you get it. But you could still, get it. You have some of the particles and the tissue inside your nose, your body's getting to it, but it hasn't quite gotten there yet. And you're still breathing in and out, and you could still shed a little bit of that virus and give it to somebody else. Or you might have, such a mild infection you don't even notice, but would be enough that some, you could have some in your breath to spread to another person.
And that's why those additional precautions of still wearing masks and still social distancing are so super important.
Exactly. Because whether you can see it or not, anytime you're breathing in that, you're breathing out little droplets, like when you breathe against a mirror, right? You're fogging it up, and that's happening all of the time. And so you're, potentially spreading whatever you're carrying, whether it's flu or RSV or just a cold, that's always how that works. But, even from the beginning with COVID, didn't make everybody sick who had it. You could be one of those silent carriers, just like before the vaccination, didn't make you sick, but your body actually was carrying it around and still breathing it out, and other people could get it, and then they just may be susceptible in a different way and could get really, really sick, life-threateningly sick from it. So you shouldn't carry, it should be a little less likely, because since you're going to get, less sick, you should have less viral load, and, it's still more likely that statistically you get it from somebody who wasn't vaccinated, but it is possible. And that's why, as you say, it's really important to still wear those masks. And I'm so grateful that we live in New York City and in a school district where, nobody was playing, and they just said the masks, we need them. And that was understood. And that was 1,000,000% the right call.
Absolutely. So speaking of, first doses, second doses, when does full protection from the vaccine kick into effect?
So, it starts, within days of when you get the first injection, but full protection is considered 2 weeks after your second dose.
Got it. And so is one vaccine better than another? We know that Pfizer is the only one currently available for ages 5 and up, or 5 through 11 now, right? And so
through 18, really,
there you go, 5 through
12
18.
to 17s are still only Pfizer also.
Got it, because Moderna is still only 18 plus,
Yeah.
Johnson & Johnson is still only 18 plus. But for members of our community who are adults who haven't been vaccinated as of yet, is one vaccine better than another?
Not that much. There have been some studies that have shown the protection of Moderna may last a little bit longer. But honestly, whichever vaccine you can get most conveniently and is at a place where you can get to and will do it, that's the one to get. I got Moderna, some of my family got Pfizer. For my booster, I'll get whatever they have. I don't mind if it's Pfizer or Moderna, because there may be a few % off from each other, but it's not that much.
Got it. Get what's available to you to make the safest decisions moving forward.
Yeah, and Johnson & Johnson runs a little lower protection than the others. But again, a lot of people, it was a good choice for a lot of people that really don't like needles, and it took everything they got to get that first dose to have the, 1 dose series instead of 2. Like the others now, they're learning that you do need the booster. So it still has a little bit lower rates than the others, but again, if that's the only one that you could get, I would still get that one.
Okay. So this next slide just puts through, right? So why should you and your child get the vaccine? So we've got some highlights listed here, right? To keep you from getting sick. I heard, Dr. Gracie, I heard you say, even if you do get sick from contracting COVID, if you're vaccinated, you're less likely to end up being hospitalized, less likely to get seriously sick, which is a benefit in and of itself. You want to keep others in your family and community from getting sick. Yes, I heard you say there's no guarantee that you can't spread it if you are vaccinated, but again, it is a much lower risk of spreading it than if you were not vaccinated. On our end, it helps to keep schools open, right? I can't even imagine what we would be doing right now if our staff was not fully vaccinated and we could not provide instruction inside of our classrooms for our scholars. The thought of having to go back to full-time remote for any extended period of time is just not a place where we want to be as a school community. And the fact that all of our staff is vaccinated allows us to make sure that they can be in the building, even when there might be a closed case. And then there's a bunch of other reasons why, right? So more vaccines, it's a quicker chance for things to get closer to normal, whatever that means. Vaccine development was fast, but as you mentioned, there weren't any steps skipped. It was just that we took the science that was already there and applied it to this new situation. The side effects are temporary. They don't mean you are sick, right? Just because you have side effects from the vaccine doesn't mean you have COVID. That's not what you're getting in the vaccine. And most people with allergies can still get it, but I heard you say over and over again, Dr. Gracie, to make sure that you are communicating with your physician if you have specific questions around your own health. Pregnant, again, talk to your doctor. But you also mentioned the risks that are associated with getting COVID while pregnant and how serious that can be as well. And then, of course, even if you've already had the vaccine, it can add extra protection against the other variants of the virus. Anything that I missed in terms of this as another reason why our members of our community and our scholars should get vaccinated?
Just a couple of comments. First, that you are an excellent educator. You're so good. I remember being impressed last time too, and you're amazing. But with winter coming, that's always when we see more respiratory viruses. People are inside more, they're closer more within families, within activities. We'll probably still see a swing up again. Right now, as of today, there's still in New York City like 1,000 cases a day. So even though it's not like this huge surge where we had in the very beginning, don't fool yourself that it's gone, because it's not gone. People are still getting it. People are still needing to be hospitalized, and people are still dying from it. So it is not gone. But we have this amazing chance to protect ourselves, our kids, and our families, and where it doesn't take the risk away. The risk of getting seriously sick is so much less. So especially with winter coming, with holidays coming, times you may want to even be able to travel a little bit this year, see your family, be close to people who may have a different risk profile than you. Best thing you can do is get vaccinated to help you and to help everybody that you're with and you're around too.
Makes a lot of sense. Let's talk about additional and continued precautions. So I'm going to ask it, although we talked a little bit about it. Do we need to wear a mask and avoid close contact with others if we are fully vaccinated?
In general, yes. So, on the subways, yes. In school, yes. In the grocery store, yes. Really, it's prudent to still do those things. At your family's Thanksgiving dinner, not necessarily. If you're within your smaller group, especially if everybody in your group has been vaccinated, that's a conversation you guys need to have with each other. But in general, within families, no. And happily, now that we can get the little ones vaccinated, at least down to 5, that's so much safer for them that we're not risking them by what we do or don't do for ourselves. But in terms of public places and things like that, yeah, I still would. I mean, if you go into a restaurant and you're at your table and you're, distant from other tables, you can do that. But anywhere that there's crowding and you're close to people, yeah, you should still wear it.
Yeah, that's interesting what you mentioned around like family get-togethers and still engaging in those conversations. My nephew is only 8, and so he hadn't had the opportunity to be vaccinated. And so when we were going to be together inside, we put our masks on, even though the majority of us were fully vaccinated, and he had his mask on just because we knew he didn't have that extra protection. And so I'm really excited that he's being signed up to get the vaccine, so that this way we can try to have as normal a Thanksgiving as possible, and know that we're all protected and protecting one another.
And I think that's great that you did it that way, because number one, if everybody wore their masks, it didn't make him feel bad of being the only one that had to wear one, which is obviously a big deal for anybody, but especially a kid, but also with understanding that his mask helps protect him, but your mask on you also helps protect him from whatever's coming out from you, even if you feel fine. So having that double layer of protection, having you wear it and having him wear it was really the way to go. But I think even just from a mental health and social standpoint, that was a really cool way to do it.
Thanks. So do you still have to quarantine if you are vaccinated and have been exposed to COVID? And then why do you need the vaccine if you already had COVID and are still testing positive for antibodies?
Okay, so a couple of different things there. And so rules about quarantine, there's CDC recommendations, which in general, if you're vaccinated, you don't need a quarantine unless you're having symptoms, in which case quarantine until you figure out what's going on there, because you could have a breakthrough case.
That makes sense.
But then I would also check with where you work, because there may be different levels of caution based on who you work with, how high risk those people are, and just different environments. So for us in healthcare, there's a particular algorithm that's different if you're vaccinated versus when we weren't. So, now we can go back to work quicker, and you're only pulled off of work if you have symptoms, and then you're pulled off of work, and then you're tested a couple of times, and then it's determined when you can go back or not. But much less than before. But again, check the specifics of where you work. In terms of testing positive for antibodies, so this came up early on before we had the vaccine. And I had mentioned earlier that I had a mild, I was exposed to it before I got the vaccination. I was never particularly sick, but I got tested for antibodies when that became available, and I had them. But what they've told us from the very beginning of, with that kind of antibody test, even if you have them, that doesn't necessarily mean you have enough that's protecting you, or the right types that are protecting you, or ones that protect you from whatever strain is out there right now. So pretty much you shouldn't use having the presence of antibodies to guide any decision that you have. If you have them or if you don't have them, you should still be vaccinated with, the full series.
Okay, that makes sense. If people express that they feel safe by wearing masks, washing hands, and distancing, and therefore do not feel the need to get the vaccine, what would you recommend or suggest we say to these people?
I think that depends on who it is and what your relationship is with them, and if it's your house or at the grocery store or at their house, or, I think it depends on a lot of those things. So we all got to use our social skills and but also our empathy and such, and never assume everything that's going on with another person. But I think when you can have that conversation to help encourage somebody else to get it and share knowledge that you have, or your personal story, if there were things that made you worry but that you overcame and decided to get it, I think those can be very helpful for people, and it can be very normalizing to hear that other people were worried too. But what helped you make the decision to get it, I think that can be very powerful for people, just hearing your own story for that. I think having some patience, but I think if it's your house, your rules, so you get to make those rules to keep your family safe in whatever way you feel is appropriate. So there are certainly people who, to get on the Thanksgiving invite list, you got to be vaccinated. That's your prerogative to do that within your home. So, kindly and all of that, but.
Absolutely, right. We want to make sure that we're creating safe spaces to keep people talking, right? And keep people asking questions, and not feeling judged because of a decision, that they might choose to make, because as you mentioned, we don't know all of the specific variables associated with someone's individual health or their reasoning behind it. But certainly, as you mentioned, right, thinking about that space, and if it's your space, you have a right to set the conditions under which people enjoy that space with you. So of course, we want to make sure that everyone has the information out there about the vaccine and the way it can help to keep us all safe, but we want to make sure we're continuing to protect ourselves, our families, and our communities. Symptom screening, right? We have it at school. If you are feeling sick, stay home. It is not worth coming into the building. Make sure that you're checking out first with your doctor, right, to see if it's anything more serious. Definitely in terms of masks, right? We are making sure that our school communities are wearing them, but also make sure that when you're in other areas, grocery stores, clothing stores, things of that nature, that you are protecting yourself myself and helping to protect others. Hand washing, I don't know how many times I've sung happy birthday while washing my own hands just to make sure I'm washing
Very
them
happy.
long enough. Or the ABCs. And then social distancing, really trying to make sure, right, that we're giving everyone their space so that they can also feel comfortable. It's not just sort of physical. You mentioned the social and even emotional and mental aspect of it, right? It's been more difficult, I think, to interact with people in closer proximity. So I think that the social distancing also helps with that mental piece of helping everyone to just feel more comfortable. I know that we have some questions in our Q&A from our community members, so I'm going to throw those out to you, Dr.
And boy,
Tracy.
Timothy, I'm still thinking about unvaccinated people and how to help take care of them. I'm feeling bad, but if you're having your Thanksgiving and you don't want to leave somebody alone, but it's your rule that people have to be vaccinated and they're not for whatever reasons they have, which are their rights, there still are ways to include people. There's still Zoom and inclusion and ways that people connect. It's still pretty nice outside. You can still go for a walk with somebody with some space and be outside. That gets harder as it gets colder, but I think it's still important to check on each other just as good humans and make sure each other are okay, but you might have to be a little more creative with it.
That's a great point. That's a really great point. So our questions from our community, if my child is turning 12 years old in 2 weeks, happy early birthday, should I wait? Will my child get 2 different doses? If my child gets it now, then when they turn 12?
Yep. So that's great and happy birthday. I would get it as soon as my kid is eligible. So I would go ahead and go for it because, like we said, you can even get it in between doses. And, I say the quicker you can protect, the better off you are. So I would go ahead and get that first dose now, and they'll get the littler dose first. And then when they're due for their second shot and it's after their birthday, they'll get the bigger dose. And then, 6 months later, they may be eligible for a booster or something too. And then they would continue to get the bigger dose for those, but I'd go ahead and go for it.
That's interesting, right? Unfortunately, COVID doesn't work on our timeline. And so if something's available, that's usually the best bet, right? To get it done as quickly and as early as possible, if that's already the decision that you're planning on making as a parent. Another question that came to us is, does COVID antibodies help keep you from getting sick with COVID-19? Tell us a little bit more about the antibodies. I know that's definitely a source of confusion for me when I'm watching the news. I'm like, antibodies, I don't know exactly what this means. Help us out.
Yes, so that is what your body's making antibodies, and it's hard to describe. I always think of the little picture where it looks like a little Y and it catches the protein that's infecting you and protects you from it. But yes, so those antibodies are what you're making in your bloodstream that makes you ready to defend yourself against any particular virus or pathogen. So it's great if you have them. It's just not clear, from a blood test, do you have them at a level or in a way that's going to protect you from whatever you might be exposed to. So whereas, yes, it's the same thing, but it's just with that kind of test, it's not the right kind of information for us to be able to say if you're protected or not. I mean, great if you have them, but you should not let that give you a false sense of security that you're protected just because you tested positive for antibodies. You should absolutely still get both doses of the vaccine.
Thank you, Dr. Gracie. I just want to make one last call to any of our community members on our webinar. If you have any questions, please make sure that you click on the Q&A feature at the bottom with those 2 text bubbles. Submit any questions you might have our way. We're getting ready to wrap up. I think we've had a wonderful evening. I think this was super informative. Just to hear the information over and over again in the smaller setting with very direct questions that our community members wanted to make sure were answered has been so helpful, Dr. Gracie. We really appreciate you being with us tonight.
My pleasure. And what I can also do for that last question that's a little complicated, kind of in how do antibodies work, let me look and see if I can find something that's kind of geared towards parent education that has some pictures and things that might help it be a little more clear, because I know there's some pretty good stuff out there. And usually that's a little easier to explain when you can use some pictures, or there's even some moving graphics. So I'll take a look and I'll send you something.
That would be great. We even, our scholars are right now doing some research
Nice.
on the vaccine, just so that they are informed. And so those pictures would be helpful for them too, because if as
Great.
adults, we don't understand what antibodies
Sure.
are talking about, it'll be
Sure.
a great resource for them as well.
Well, and I have no affiliation to these places, but great sources for information in general that I like to give to parents. I mean, the CDC is good for anything like this. Mayo Clinic has really good health information topics
Okay.
at a good level. I always like their stuff. And the American Academy of Pediatrics has a site that's made for parents called healthykids.org. And that one is really good too. So I'll send you a few links that are nice. And there's also one, I can't remember exactly the name of it, but that's actually geared towards kids. That's very good as well. I think it's called Kids
That would
Health,
be
but
awesome.
I'll send it to
We
you.
welcome all resources. This last question, I can take, or I can hand it over to Ms. Franco. So will children get the vaccine at school? Will they need to take a day off due to possible side effects? So I can say right now as a school, outside of the pop-up events that we're alerted to, there isn't the vaccine currently being offered. That being said, we do have a pop-up coming up. We will, if the information hasn't gone out already, we will make sure to provide that. And we will, of course, advocate for additional pop-ups to come to our school building. If we know that we have parents that want their child to get vaccinated in school, there's a little bit of a process in terms of signing consent and parents being there based on age requirements. And then in terms of needing to take a day off, should there be side effects, as any other situation, if your child is not feeling well, of course, we want them to stay home to feel better. That would be an excused absence, so don't worry about it on that end. But Ms. Franco, anything additional that you want to add?
No, I just want to thank you both tonight, Dr. Gracie and Ms. Souza. If your first careers don't work out, you guys definitely could take this show on the road. You do a great job together. So no, thank you both for your time tonight. I know our community appreciates it. And thank you everyone for joining us.
Absolutely. Thanks, Ms. Ramsey. Thanks for joining us.
Bye,
Thanks,
Dr. Gracie. Thanks so
Bye.
much, everyone.
Bye, everyone.